Good afternoon, my professors, lecturers, and everyone here present. I'm Holmes Eyoanwan Eyo, and I'll be presenting on the topic, the interconnection of metabolic disorders and mental health, strategies for integrated care and support. Before I begin, I would like to note that this topic arose primarily in focus of the theme of this conference, which is mental health and economic productivity, forging mental well-being in the face of crippling economic challenges. Introduction. Historically, psychiatric and metabolic conditions were treated entirely separately. However, recent research have established that this bidirectional relationship, excuse me please, historically, psychiatric and metabolic conditions were treated as entirely separate disease entities. However, recent research have established that this is a bi-directional relationship and a public health crisis. Patients with major mental illnesses uh, face, dramatic, face dramatically elevated risk for conditions like type 2 diabetes, cardiovascular diseases, etc. Please, I would like to skip to the aim of my study. The primary aim of this comparative literature review was to address the urgent need for integrated care strategies by examining the complex bi-directional relationship between major mental illnesses and metabolic disorders. The objectives of this study included to quantify the mortality gap and severe co-prevalence of metabolic diseases in MMI populations, to explain the shared biological mechanisms focused that prevent integrated treatment, to validate the collaborative care model as the superior evidence-based strategy, to formulate actionable policy recommendations for integrated care, implementation, and workforce education. Materials and method. The study design for this work was a systematic literature review. The primary searches conducted were across academic and medical databases as listed there. Systematic reviews, meta-analysis, and landmark randomized control trials were used for this study. I considered data that was conducted within 5 years. Opinion pieces, single case reports, and animal studies were excluded from the study. For my results on bidirectional risk and clinical outcomes, individuals with bipolar disorder or schizophrenia existed a 2 to 3-fold higher prevalence of type 2 diabetes and cardiovascular disease compared to the general population. Antipsychotic use significantly drives this risk. Metabolic syndrome is a primary driver of the 10 to 20-year reduction in life expectancy observed in people with severe mental illness. Increased ultra-processed food consumption is associated with a 20 to 50% higher risk of developing depressive symptoms, highlighting the behavioral metabolic link. Under shared pathology and mechanism, both MDDs and obesity are linked by elevated peripheral cytokines. These signals cross the blood-brain barrier, inducing neuroinflammation and compromising insulin signaling. Brain function is impaired by metabolic failure. The resistance in the central nervous system accelerates neuronal aging and is hypothesized as a mechanism for cognitive impairment and depression. Adherence and symptoms inference. Symptoms like ahenuria and amotivation directly interfere with self-management. Study shows that addressing the psychiatric symptoms improve adherence to metabolic regimens. Patients face prejudice related to both their mental illness and their physical condition, which leads to avoidance of care and poor self-management. Under integrated care and efficacy, the independent randomized clinical trial demonstrated that collaborative co-models for patients and comorbid type 2 diabetes mellitus and depression significantly improved both depressive symptoms and metabolic control simultaneously. Meta-analysis confirmed that collaborative co-models is a cost-effective solution, often leading to lower long-term overall healthcare spending compared to fragmented care. Structured comprehensive lifestyle interventions are proven to reduce inflammatory markers and improve both metabolic and mental health outcomes. Discussions and implications.
Time up.
Conclusion. The study concludes that metabolic disorders and mental illnesses are critical clinical cases that arise from systemic immunometabolic dysregulation. It proposes that collaborative co-models are the proven and most cost-effective structure required to prevent diagnostic overshadowing and improve both metabolic and mental health outcomes simultaneously. My recommendation: investment in research focused on how to scale collaborative co-models successfully and sustainably across diverse low-income community settings. Exploring pharmacological agents that addresses the shared biological pathways to treat both conditions simultaneously. Encouraging cross-specialty literacy to address the lack of awareness barrier through training psychiatric in metabolic risk and primary caregivers in mental health literacy.